There we go. All right. Hey guys, it's Charlene Smith. So for the graduate presentation lesson plan, my case study client is a 35-year-old female Army vet who sustained a TBI, traumatic brain injury, roughly 8 months ago. It was from an IED blast. And I have the lovely Amy here today, who's going to be my Sarah. Some of the characteristics that my client has, I'll just go to the goals real quick so you can read them, is she had a moderate traumatic brain injury with a Glasgow coma score of 11 at the time of injury initially. She also has a right-sided hemiparesis, which affects her motor control in her dominant hand. She's also showing signs of moderate attention and memory deficits, word finding difficulties, and reduced verbal fluency, reading comprehension difficulties, diminished problem solving abilities, occasional dysphagia, specifically with swallowing, fatigue and reduced stamina for cognitive tasks like staying on task and paying attention for longer amounts of time. And she's also been having sleep disturbances. She was, when the TBI initially happened, I had her as experiencing a loss of consciousness for roughly 35 minutes, being transferred to a field hospital, then to Germany, then eventually to Walter Reed, which is well known for its care of our veterans, especially those who have been in catastrophic incidences, excuse me, for a more comprehensive rehabilitation. Am I? So you can see her long-term goals. The first one is for expressive language and word finding. It's not the one we're going to be presenting today, and she also has another long-term goal for cognitive communication. But we're going to work on short-term goal number 1, which is Miss Sarah will read a 2-paragraph news article. This one's a little longer than 2 paragraphs, so just 2 paragraphs and answer 5 comprehensive questions with the 80% accuracy across 3 consecutive sessions. So generally, her session goals will entail expressive language, cognitive communication, as anyone would probably do with a traumatic brain injury patient who is on, the road to recovery. Here it is. Okay. So to go deeper into the reading activity for reading comprehension activity, we're not going to spend 10 minutes on it, but the goal address again is cognitive communication. Sarah has the article already in front of her. So the client's going to read the article either aloud or silently, whatever they prefer. I know there's a lot of, excuse me, a lot of just like inference and being cautious, especially after experiencing something so traumatic, not to be redundant. So then we'll just ask a couple of questions, main idea questions and inferential questions, and then discuss any strategies that she may need to improve. So Sarah, if you'd like to just pull up that article that I sent you from Military Times, because I know you like to stay up to date on what's going on, even though you're out. You can either read it aloud or read it to yourself, the first 2 paragraphs, and then we can just discuss it.
Sure, yeah, I can read it aloud.
Okay.
So, the Army is conducting a series of pilot studies to determine how to deliver its new all-around health and fitness program to Guard, Reserve, and other dispersed units. Lieutenant General David Francis, head of the Center for Initial Military Training and Deputy Commanding General of Training and Doctrine Command, told Army Times in a recent interview that the service is set to have 71 active duty brigades with holistic health and fitness resource teams by October, well ahead of the service's goal of reaching 111 brigades by 2030. Now, the Army is turning its attention to Guard and Reserve troops. A series of pilot studies will examine how the fitness program, also called H2F, can be implemented among dispersed units, including Guard and Reserve components and units with less than 1,000 soldiers. The first starts this summer at Joint Base Lewis McChord, Washington, with an active duty unit. Would you like me to keep going?
No, you're good.
Okay.
Okay. So without looking directly at the article again, what month did they want to start this new training process with the Army?
By October.
Yep. And I'll put this as a two-part question, especially if it's a little too difficult for memory for you, because I know you've been having issues with that. How many brigades did they want to be included into this study?
111.
Yeah. And do you remember by what year they wanted to have that 111 brigades ready and participating by?
2030, I believe.
Yeah. Awesome. So you are having now, how did that feel reading that those two paragraphs out loud? Did you feel like you struggled with any words or comprehension at this time? Because I know we've had a couple instances where there was some words that genuinely frustrated you before.
I thought it went well. There were a couple times I felt like I got lost in my own head. Um, and I was just sort of reading out loud, but in general, yeah, today's a good day.
Yeah, it is a good day. That's really great. Now, generally, when we would go through articles and whatnot, we try to find articles that keep our clients engaged and they're not overly stressful on what they're going through. So what did you think of this article on a personal level?
I felt it was really positive, which is nice, especially after everything I've been through. It's nice to see um, the government looking at a holistic approach for um, preemptive measures to help our troops.
Yeah, yeah, it seems like the holistic approach for our active duty and veterans seems to be becoming very focused lately. All right. So thank you, Amy. Another goal, since, as you heard us discussing, um, since Miss Sarah, Amy, um, has some memory issues, just getting her to use her calendar in her phone for everyday things, whether it's appointments, um, taking the dog for a walk, taking her any medications they may be on for post-concussion disorder. Um, and then just like discussing it because we can share a screen either way. And that's one of the good things about telehealth these days is you can be on your computer and have your phone mirrored onto your laptop. And luckily, Miss Sarah is very technologically inclined. All right, so generally we do a quick closing, about 2 to 3 minutes, talk about everything she did really well today. Like today was a great day for memory and a great day for reading out loud, which a lot of TBI patients have an issue keeping the fluidity going. Sometimes it gets better, sometimes it does not. It depends on the severity of the TBI. And normally we'd give some homework um, and practice with her husband, Matthew, and her daughter, Emma, has been getting very engaged in this because she wants to help mommy get better. Um, so one of the homework things that I'd assigned would be reading short news articles daily with her husband and using smartphone memory strategies for at least a couple, like I said, a couple things during the day, and then eventually work up to more complicated tasks. And those are the couple of references, excuse me, for the PowerPoint. And I think that's it. And Miss Sarah, do you have any questions for our session today? Or anything you'd like to work on next time?
I really enjoyed reading the article and then answering questions. Maybe that's because today is a good day, so I feel motivated. But I liked the content, and I appreciate you finding articles that relate to my interests to keep me motivated.
That's, you're welcome, and I'm more than happy to be here for you through everything you have gone through, and I'm extremely appreciative of your service. And you know, healing takes time, and you're tough, and you've proven that.
Thank you.
All right. Thanks, Sarah. Bye-bye. I'm sorry. I'm trying.
What?